Before I get started, and like a lot of people stepped out, I know, so the room's like half empty as it was, but I've been meaning to do this for a couple days now. So can I hear from the people who are local to Chicago, just since we're in Chicago? How many of y'all are from Chicago? A few hands, okay. And then how many are from St. Louis? What? Woo! Look at that representation, St. Louis. All right, I'm from St. Louis, I just had to do that. Go Cardinals. Okay, I am glad to introduce our next speaker. Dr. Marianne Andrade Becker received her Master of Arts in Counseling and Doctorate in Clinical Psychology. Her pre-doctoral internship focused on chronic mental illness, neurodiversity, mood disorders, trauma, and grief. She has practiced in the Will County Health Department, in the Forensics Unit, the University of St. Francis Counseling Center, and community group practices in the south and north sides of Chicago. Dr. Andrade Becker has experience working with individuals from many backgrounds, including those with cancer. She believes people are wired for connection and are strengthened through community. Thank you, Dr. Andrade Becker, for sharing your time and expertise with us today.
Yes, but they're out there.
Oh, nice.
Just different.
Okay.
Good afternoon, everyone. I'm hoping that you're having a wonderful time at the conference. It has lots of great information, and I'm a big proponent of working with systems and communities, and I'm hoping that you're also finding community with us as well. Before I start, I wanted to leave a disclosure. I have no financial relationships or affiliations to disclose outside of my employment at Gilda's Club Chicago, an affiliate of Cancer Support Community. Gilda's Club's mission is to uplift and to strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. I've actually been with Gilda's Club for the last 7 years, working initially with prostate cancer support groups. I'm now leading a weekly caregivers group as well as a bereavement group, but we do have a lot of free programming in our Gilda's Club Chicago clubhouse that you can all check out if you're in the city. And we do a lot of different activities, not only with mental health, but with nutrition, building community, art therapy, fun events. We really hold a passion to caring for the whole system for not only the person who is impacted by cancer, but also by their loved ones as well. So what is mental health and why does it matter? We talked a little bit about stigma today, and I think that actually ties into our presentation with mental health. When we think about mental health, we think about people erratically behaving unwell, or their moods go up and down, and they don't have a lot of consistency. But mental health is actually more than that. It encompasses 3 main components: how about I think, how I feel, and how I feel connected with others. Especially with our feelings and emotions, we see a lot of ups and downs, especially with cancer diagnoses or with families that are going to treat their loved one, not only with the support, but then also transportation, about like sitting with their loved one receiving the treatment. And those days can have an emotional roller coaster feel. There's feelings of nervousness, feelings of anxiety, feelings of like, oh, I'm gonna kick cancer's butt, right? And so we also have to pay attention to how we feel, and that can be brought on with specific events, right? If we have a bad day, we most likely will have a foul mood, but we also have experiences where there may not be initially a triggering event. It can be what a lot of us can see is that we try to push forward for too long without a break. Struggles with mental health can influence not only our available energy for different activities, but also about how well we take care of ourselves. We really come a long way to encompass mental health in terms of it being medical health as well. For a very long time, the perception was that medical health and mental health were two completely different things. But we see the interaction of mental health and physical health are intertwined. What are some things that impact mental health? I kind of think about this in 5 areas of wellness. Our physical health, our emotional health, mental health, social health, and spiritual health. When you're thinking about good mental health, think about when you felt really, really good. I felt I was productive. I felt that I was able to take on the world. Even if I had minor setbacks, I came back from that, right? And then when I think about that in the opposite end, I'm finding that I'm getting tired more often, maybe I'm getting a little bit more irritable, little things seem to bother me now, or I'm having nightmares and I'm having difficulty falling asleep. Think about mental health being encompassed in those other areas as well to kind of see where you're at. With stigma, we find that many societal and cultural aspects may place mental health as being a bad thing, right? That you cannot show your emotions, you cannot talk about what is happening with you because that means you're deficient in some way. When really that is the opposite. We find that those who are resilient and emotionally well stem from the fact of reaching out to others. I really take into account about how our Native American population views health. They view health in terms of community. When they find that their members are distancing themselves away from the community, they see this as, okay, somebody really needs to be uplifted. And uplifted not only with, social support, but also words of affirmations or prayers, or even taking care of what physical health that they can do in terms of caregiving. When we look at mental health, it's really important that we become drawn to others as a way to get the support that we need, as opposed to drawing away from them. So to start, there may be some loved ones that can be supportive of that. I think about my friendship groups, and I know certain people that I can go to. Certain people that I need to problem solve with, certain people that I can just be like, I just need to talk and just to cry and just to feel like I'm being supported. If you can think about who those individuals are in your life, those are a great starting point because it encourages you to really think about what you need from others. Mental health is something that is unlike physical health. You really can't see what's going on the inside. And I think about this a lot with my clients because they have not only oncology issues, but trauma or family stress, work stress, other medical conditions that don't necessarily have a physicality to it. And they say that, so-and-so is going through this, and I am feeling this way. I should not feel this way because they have it so much worse, right? So we play the comparison game. When really mental health impacts your physical health, right? That was a point that we talked about just a moment ago. Physical health can change when our neurotransmitters are either giving the necessary chemicals that we need to perform certain activities, either overly so or underly so, right? And there's also medical studies that have shown that people with different mental health concerns, such as depression or trauma, neurodiversity, if it's left untreated, it changes the way the brain not only works, but in its shape and its functioning. So just because we can't see what the brain looks like doesn't mean that everything is okay in terms of mental health. So that's what I try to impart on people when they question, well, why does mental health matter? Because it's also a medical matter as well. In order to normalize mental health, we have to recognize that everybody experiences stress. And I'd like to talk about 3 different types of terminology: stress, anxiety, and duress, okay? So stress is something that we experience every single day. If we did not have a little bit of stress, we wouldn't feel motivated to get up from bed and to do things with our day. We actually need stress as a way to build us up too. So when we talk about stress, we talk about it normally in a very negative manner. I'm so stressed out. I should be low stress, right? But if we didn't have stress, we wouldn't be building up resiliency muscles as well. Think of it as going to the gym. Muscles need a little bit of stress to build muscle. But the muscle is not built in the gym, it's built at rest. But if we're not having that time for us to challenge those muscle groups, having them to repair and regrow through the nutrition and the rest that we have, we're not really supporting those muscle groups in time. This is the same thing, that if we ignore our mental health symptoms and we say, like, you know what, I don't have time for that, this is too important, our bodies are literally going to stop us, and they have. That comes through the forms of like colds and flus, so you may notice like with your kids, or for teachers, for example, they can see this all the time, is that when fall break happens, everybody's excited because they're willing to go home and they have family traditions that they're going to embark on, and then that's when people get sick because they're so focused on getting things done that they're not paying attention to what their body needs. With emotions and mental health, it's sometimes difficult to be emotionally balanced, right? It's like we think that we have to be even keel all day long. And that may not necessarily be feasible because life does throw things at us. There are moments that give us pause and we're thankful for that, and moments in which we're challenged by that and we have no clue what to do. And it's really important to feel those out as well. It's not just about feeling all the good things, it's also feeling the challenging moments as well and giving them credence about what they are trying to tell you about what you need moving forward. And there may be some specific emotions that impact mental health in terms of stress, duress, and anxiety, and I'll also talk about depression as we move forward in the presentation. When we think about stress, stress is a state of feeling overwhelmed either physically, mentally, or emotionally, and this can be due to certain events, past or current trauma, illnesses. These are just to name a few. This is not a comprehensive list. Distress or duress is a higher form of anxiety. Every single patient, regardless of what type of cancer, regardless of the type of treatment, deals with issues that cause some level of distress. And caregivers also feel stress and duress as well. Duress is feeling really high end on that emotional spectrum, where you're feeling very panicky, you're worried a lot. It doesn't feel as though that you can have like your brain kind of shut off. It just kind of keeps talking and talking and talking, or moving at a million miles an hour. Or having some troubling thoughts about what the future may hold. What will the scans say? How is the treatment going to go long term? And when you don't feel that you have some level of control, we develop symptoms of anxiety, panic, or depression. Anxiety is a feeling of uneasiness, worry, or fear that usually occurs because of stress, whether that event is known to us or not. And some anxiety symptoms can be reflective of tense muscle groups, stomach aches, heart issues, difficulty breathing, GI issues, just to name a few, headaches, nightmares, difficulty sleeping. Whereas with depression, depression is more on the end where it's not as active as anxiety, but it is just as powerful. It's a diagnosed condition, and it's a medical condition. A lot of people see it as only mental health, but it actually is medical in component of that, where it causes a persistent feeling of sadness and a loss of interest in the things that you once enjoyed. And that can be if you were a very avid chess player or you loved going out with your friends every weekend and you're starting to find that you'd rather not, there's no point to doing that anymore. There's also feelings of helplessness and hopelessness or worthlessness. There are changes in the way that you're functioning physically, like you're sleeping too much, sleeping too little, having broken sleep, eating overly or not eating as much. When you're starting to have these types of feelings for 2 weeks in duration, that's when we know what we call it as clinical depression. It has little lift. You really feel like it takes a very big challenge for you to get up out of bed to do the things that you need to do. And for these types of services, you can call your caregiving support guidelines, call 988, which is a text crisis line that you can use, as well as your local Gilda's Club or cancer support groups as well. Let's talk for a moment about mental health and survivorship. I've had a lot of people that I've worked with, when they talk about feeling very happy, they've come to the point where they are not going to receive treatment because the cancer is gone. But it's not only about the joy that they have, it also comes with its own mixed bag. We hear a lot about cautious optimism. Well, I really can't trust that my body is fully healed and that the cancer is gone. And I'm just going to be okay with the fact that the doctor says I'm good, but I'm not going to completely take this as a guarantee that everything's going to be fine moving forward. We have fears that the cancer will come back. What does it look like if I have to do this for the rest of my life? How can I still live a full life with ongoing cancer treatment? And how does that look not only with me, but with my partner and with my families and coworkers? Scanxiety is a very real thing. I think everybody can recognize if you have a loved one or you're a caregiver to a loved one, that this is a time of high anxiety. And normally the scan anxiety happens about a week before the actual scan happens. And you start to think about all the things that could potentially go wrong. You think about, well, how effective is the treatment? I'm hoping that it's doing what it needs to do, but I really can't trust that it's doing what it needs to do. And in going in for the caregiver and for the patient, this is a high anxiety time. The time after that, after treatment is done, there may be higher levels of anxiety because, again, we're going back into saying that, well, there's no guarantee that I'm fully healed or that my loved one is fully healed. And we push the doctor just to be like, hey, how often should we check in with you? I want to make sure that we're doing what we need to do so we catch it if it comes back, or we support our loved one and they are doing all the things that they need to do to stay healthy. Mental health after active treatment looks like trying to transition back to precancerous life. You continue to care for yourself physically, like eating a healthy diet, getting your sleep, being involved in friendships, your social activities in your communities, finding healthy ways to enjoy life, taking steps to not only take care of your physical health, but then also your spiritual health as well. There are many different things that you can do to support that resiliency that you have. This is also a weird transition as well, right? Because you think about how for a while in that period of getting treatment, that this was our normal, and now I have to do a whole new normal. And that would look like if some people wanted to go back to work or find employment, what that would look like for them. Go back to intimate relationships, really get involved with the kids or the family, because more often the treatment takes a lot out of our loved one, and so even though they want to be present, it's really hard for them to do that, and so now they want to jump back into being more involved, dealing with finances, going back to daily life responsibilities or hobbies that were very important to them. But if there is relapse or recurrence, what we would ask you to do from a mental health standpoint is not again to withdraw. We want to stay in the community, stay in with your support network. And there are many different types of resources that are out there that can be helpful. We have a lot of support groups, talking to a mental health professional, doing some stress-reducing activities. I love somatic exercises and yoga for that particular reason, or using holistic care as medically indicated, as well as staying in contact with a palliative care team if that's part of the treatment. We want you to stay connected with loved ones and your care team about how you're feeling. And I think a lot of what was said in our conference today is that we want to build supportive relationships, and that extends beyond family and your community. It also means that you have to trust your medical team too. And if you find that you do not trust your medical team, that's going to add more to your mental health. So it's very important that you're surrounded and wrapped around by all types of supportive people from different backgrounds to get the treatment that you need, as well as the support that you need. In terms of support during survivorship, there are additional resources specific to cancer survivorship, such as support groups, peer mentoring, and survivorship care plans. Gilda's Club also has specific support groups based off of cancer types, as well as for caregivers as well, that we offer. And we try to offer that as often as we can, because we recognize that this is an important resource, and this is one way for people to feel connected, because often we hear that a cancer diagnosis really changes the way that people can look at you or relate to you, and you're in a community of people that understand where you're coming from. So let's talk about caregiver mental health for a moment, because this is also very important too. We've heard from the caregiver panel that it's very important to know how full your cup is, because you cannot pour from an empty cup. And it's very normal to have a lot of challenges in that caregiving role. Caregiving for your loved one, even though that is something that you would not do, comes also at a price as well. You may feel scared, stressed, worried. You're also trying to care for your own health during that time. I find that with a lot of my caregivers, they push off their medical appointments because their loved ones' medical appointments are much more important. So again, we're going into that comparison piece. But then other group members and myself encourage them to get those appointments in, because they also need to feel well. They're also challenged by other things in the family system and the community system. A lot of cancer diagnoses do not happen in a vacuum. Life still happens. And many caregivers also have children, are working full-time, also are leaders in their community, and so they're trying to balance all this stuff on top of taking care of their loved one, which creates a very unique stressor for them, because then it feels as though that they have to be Superman or Superwoman to manage all of the things that are going on in the household. So we encourage our caregivers to be using resources that are available to them. And that, again, can be support groups, one-on-one therapy, reaching out to a local caregiver support program, or through Gilda's Club. And the biggest proponent of that is to encourage our caregivers to ask for help. Again, they become that point person in many ways. They're usually the person that transports, sits with their loved one through treatment, tries to coordinate all the family things and not drop the ball. And it becomes a very lonely experience, and they forget that they can also ask for assistance as well. And this is actually where we don't want our caregivers also to withdraw from the community, and we want them to engage in that support system. And I've seen Family responses to that being like, well, it's all on me and I have little support, please reach out to us. We can find other ways to make things a little bit easier. If that means thinking about how can we take care of meals, so that's one thing off your off your plate. If that means talking to other caregivers who are in similar situations to problem solve what that looks like, we want to give them the support that they need as well. A lot of the challenges that caregivers give, even though that we touched upon a few of these already, really comes into thinking about how are they also managing not only the physical health, but the mental health and the emotional health. Because again, like all of this kind of happens and it feels like a whirlwind experience, and it's interesting how as human beings we adapt to situations really quickly. And sometimes we can go with the blinders on and we don't get to see the full picture because we're so focused on what's happening in the moment. So it's very important for our caregivers to seek the support that they need, whether that's through friends, their communities, their churches, or in places like Gilda's Club. Let's talk about ongoing self-care for a moment. There are many different types of support options. Obviously, I'm going to promote mental health professionals as being one form of that. There's also local groups that are either low cost or free. We do have a cancer support community, and I have the number up here, as well as the website, as well as National Alliance on Mental Illnesses, NAMI. If you want to take a screenshot of this before I move on to that, keep these numbers with you. Even if you feel like you may not need them right away, there may be people that you know who would benefit from these services. So go ahead and take that for them, because I'm a very big person about like making sure we get all the information and resources that our community needs so that they can get the support that they need. Other things that we want to talk about in terms of support options, definitely stay in touch with the care team and any medications that may be supportive of your mental health. We talked a little bit about genetic testing earlier, about checking to see what other medical diagnoses that we may want to be privy of. There is also something for mental health as well, but in the vein of trying to find psychotropic medication to best fit that individual. What types of medications would be best for this individual if they were going to be treated for depression or anxiety or trauma. So then it kind of steers away from a little bit of that guesswork, if you will, and it becomes more of an individualized treatment plan. Working with a psychologist or a licensed therapist or social worker is definitely another way to have that level of support, to have them navigate with you how to talk to your medical provider, especially your psychiatrist, about some of the things that you've been talking about and they've been tracking with you. And sometimes having that partner in there where they can talk that language and then also be able to focus on you and making sure that you get the needs met that you need is very helpful. And then definitely be sure to talk to your oncology care team if you're thinking about taking any new medications, because we don't want new medications being introduced without the team knowing, because that can have a negative interaction with other medications that that individual may be on. So it's best to have everybody in the same page, in that same support care. So what can you do now to strengthen your mental health? Anything that you would like to, that you enjoy. Anything that brings you a sense of like it's fun or it's fulfilling or it's something that you can be on your own and be more mindful about the pleasure that you're taking with said activity. Learning ways to take control of your emotions, such as using coping skills when you're feeling overwhelmed and distressed. There are many different types of coping mechanisms and coping tools to manage anxiety, depression, trauma. Not one tool is best for everybody, so I say, let's just figure out what is going to be best for you, because what may work for you may not work for another individual. Another big thing is to focus on things within your control. And I find that a lot of individuals who are impacted with negative mental health, part of this is to focus on what can you do? right? When we think about cancer, we say like, there's nothing I can do about that. I have to rely on my doctors to treat me, when really that's not so, right? There's also the mindset about how you're looking at treatment, who you're being drawn with, who's your support network, how are you finding joy in life despite this really difficult diagnosis, and that actually builds up mental resiliency. Definitely maintaining healthy behaviors, eating well, sleeping well, getting physical activity, feeling connected with your loved ones and with your community, or even, having some communal activity like a group walk or a group meal, group outing, or ways that we can do to support positive mental health. I also have up here our Gilda's Club Cancer Support Community Resources. If anybody is in the Chicagoland area and you'd like to check us out, please screenshot this, or if anybody that you know who is in the city would like these resources, please pass that forward. We have 2 locations, one in the downtown clubhouse on Wells Street and another location at Advocate Christ Medical Center in Oak Lawn. We update our website monthly, and we have different types of activities for both caregivers and our cancer patients, as well as supplying them not only with individual therapy, but again with support groups, creative movement, nutrition classes, fun outings. I think recently we had a group go to Brookfield Zoo as a group, and we were able to have the park and the parking on our own before it was open, so it was nice to just kind of be with other people that, again, are in a similar boat, but you're in a different setting, right? You're enjoying life, you're thinking things away from cancer and really kind of thinking about what you can really enjoy in that moment. And I want to say thank you to our sponsors as well. And I'd be happy to take on any questions if there's any comments or lingering things that you'd like to know about in terms of mental health and mental health treatment.
Any questions? You guys exhausted? You need to be fed again, don't you? No, I'm just kidding.
That's very important too.
Okay, anything for Kevin?
He works for